Changes to Medicare that advocates have been seeking may end up in the next federal coronavirus relief legislation, experts say. The Republican-controlled Senate is expected to unveil its version of the next stimulus package in late July as the COVID-19 pandemic continues to slow economic recovery and unemployment remains high. Senate Majority Leader Mitch McConnell, R. Kentucky, indicated in public comments Monday that the theme of the next relief legislation would be liability reform, kids in school, jobs and health care. While specifics of the legislation are uncertain, consumer advocates hope to see provisions that would improve access to Medicare, which provides health care coverage to about 62.4 million beneficiaries, the majority of whom are age 65 or older and more likely to suffer complications from the coronavirus. The program also covers younger individuals with disabilities and people with end-stage renal disease. I suspect there will be some Medicare provisions, said Tricia Neuman, executive director of the Medicare Policy Program at the Kaiser Family Foundation, a nonprofit group focused on health care research and policy. The Democrat-dominated House already passed its version of the next round of stimulus, called the HEROES Act, but the Senate is not expected to consider it. Nevertheless, lawmakers in the upper chamber could use parts of that bill for inclusion in whatever they propose. Even though the HEROES Act wasn't bipartisan, some things in it may have a chance because they are logical and bipartisan asks, said Lindsey Copeland, federal policy director for the Medicare Rights Center, an advocacy group. Here are the Medicare provisions Copeland says could make it into the next stimulus package. Some people miss the deadline for enrolling in basic Medicare, Part A hospital coverage and/or Part B outpatient coverage, even if they are 65, which otherwise would make them eligible. Instead, unless they meet an exception qualifying them for a special enrollment period, they have to wait until Medicare's annual general open enrollment, which is January 1 to March 31, with coverage starting July 1. That delay could mean life-lasting late enrollment penalties for not signing up when they should have, as well as a potential gap in health care coverage. We see this more often than you'd think, said Danielle Roberts, co-founder of Boomer Benefits, a Medicare insurance agency. This category could include people who missed their initial enrollment period at age 65 without having acceptable health insurance as deemed by the government in place of Medicare but didn't realize it. Or it could be a person who didn't know they were eligible to enroll or were unable to sign up during the pandemic. It sort of adds insult to injury because you're finally eligible for Medicare, but because you missed a deadline, you can't enroll, Neuman said.